Within the first 5 years of menopause, a woman's body loses up to 30% of its collagen. This rapid depletion compromises the internal structures that support a woman's pelvic health, leading to a significant loss of tissue density. Tissues that were once thick and resilient lose their ability to retain moisture. For many women, this results in unexplainable dryness and intimacy that becomes agonizingly painful. The structural loss extends further. Weakened support tissues lead to stress incontinence, where the simple act of laughing or sneezing causes an embarrassing leak. These symptoms are frequently dismissed as an inevitable part of aging, yet they are the direct physical output of a specific, measurable microscopic collapse. The daily physical discomfort many women experience is rooted in specific changes occurring within the reproductive system, changes that are often overlooked in standard clinical consultations. Conventional advice often suggests that women simply endure the pain. This approach fails to account for the underlying cellular mechanisms that drive these symptoms. To address these symptoms effectively, we must identify the specific biological catalyst orchestrating this loss of structural integrity. Identifying the specific microscopic trigger for this collapse allows for targeted clinical interventions that can address the root cause of the discomfort. At the cellular level, these structural changes are regulated by a single chemical messenger, estrogen. During a woman's reproductive years, estrogen is produced in a reliable, cyclical pattern by the ovaries. Estrogen molecules bind to specific receptors to stimulate the formation of a dense, interconnected collagen network. This network provides structure, maintaining the thick, folded ridges of the vaginal wall. A robust structural network supports internal vascularity, ensuring steady blood flow and critical moisture levels. Biologists refer to these essential folds and ridges lining a healthy vagina as rugae. While estrogen directs collagen production, the female pelvic architecture remains structurally sound and resilient against friction. The menopausal transition marks a biological shift where the ovaries systematically shut down their estrogen production. Without the influence of estrogen, the body's ability to produce and maintain collagen stalls. The physical breakdown is visible at the microscopic level. Elastic cellular fibers snap under tension and wither into brittle strands, destroying structural integrity. Without collagen support, the rugae flatten out. The vaginal walls reduce to a thin, fragile layer. This physiological state, known as vaginal atrophy, results in severe moisture loss, persistent burning, and high vulnerability to minor irritation. This cellular decay starves the pelvic floor muscles of structural proteins needed to support the bladder and uterus. When weakened, mechanical pressure causes organ displacement, forcing bladder leakage during physical activity. The pain and incontinence introduced earlier are the direct consequence of this biological starvation. Leaving these microscopic changes unaddressed often leads to a worsening of symptoms. Untreated atrophy can result in chronic pain, which frequently leads to emotional isolation and the deterioration of intimate relationships. However, because the biological mechanism is understood, this cellular decay can be addressed and managed through clinical intervention. This timeline chart compares two paths. One shows continued structural degradation, while the other shows how hormone replacement therapy restores the estrogen supply to stimulate cellular regeneration. Targeted medical intervention allows menopause to be managed as a treatable biological state rather than a period of inevitable physical decline. Clinical studies show that hormone replacement therapy can rebuild the collagen network, restoring tissue thickness and elasticity. Recovery often involves complementary therapies, such as targeted pelvic floor exercises, to rebuild the muscle strength necessary to support internal organs. Localized solutions, including high-quality moisturizers, can provide immediate relief from friction and pain while deeper tissue health is being restored. Implementing these protocols allow women to return to a life of active, uninhibited movement, effortlessly maintaining their physical comfort, vitality, and overall strength. Consulting a healthcare professional to discuss these personalized management strategies is the first step toward addressing these symptoms. Applying these biological insights provides a clear path to managing your cellular health and maintaining physical comfort through the menopausal transition.